This study was specifically looking at long-term impacts of vaccination on children. This study was presented at the Permanent Committee on Investigations of the United States Senate September 9th of this year, so just a couple months ago. So what they did is they got a large number of children who had been vaccinated, and they also had a large number of children who had been unvaccinated, and they compared their long-term health outcomes. This study was actually performed by somebody who was trying to prove that vaccinations are great and that vaccinations improve health outcomes. What the study actually found instead was the opposite. So look at this chart. This is directly from the study, and you can see the column showing children who were vaccinated, and that includes even just one shot of vaccine, compared to children who had not been vaccinated at all. So what you see here is greatly increased rates of different types of illnesses in the children who were vaccinated compared to those who were not vaccinated. Be careful when you're looking at this chart. The number that you can see that's not in parentheses is showing how many children had that particular condition in that group. But there were over 8 times as many vaccinated children in the study as there were unvaccinated. So it's not really comparing apples to compare the numbers. For instance, asthma here, it says 2,867 of the vaccinated children had it versus 52 in the unvaccinated. Those two numbers aren't comparing apples to apples. What you want to actually look at, though, is the number that is highlighted in orange there. And that shows the incidence per 1 million. So those are population adjusted numbers. And you can see asthma here is over 4 times higher in the vaccinated group than the unvaccinated group. You can also see that atopic disease, that's basically allergies. There's a 2.64 times increase in allergies in the vaccinated kids compared to the unvaccinated. Autoimmune disease, a 6 times increase. If you go down and look at some of the other conditions, for instance, developmental delays, there are much higher rates of that, much higher rates of speech disorders also in the vaccinated groups. The overall conclusion from this study, quote, exposure to vaccination was independently associated with an overall 2.5-fold increase in the likelihood of developing a chronic health condition when compared to children unexposed to vaccination. This association was driven primarily by asthma, atopic disease, which is allergies, eczema, autoimmune disease, and neurodevelopmental disorders such as ADHD, developmental delay, speech disorders, etc. So a 250% increase in these chronic diseases in children who were vaccinated compared to those who were unvaccinated. The link is here if you want to read the study. I highly recommend you print it out, go through it, understand what it really means. It's at an inconvenientstudy.com.